Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi. And on this episode, we're going to talk about something that every single person has at one point or another. I guarantee it. Okay, what is it? Well, have you ever had neck or back pain and probably wondered, is this pain normal? Should I be worried? Do I need an X-ray? Do I need an MRI? Or do I need a CT scan? Am I overthinking it? Today, we're going to set out to answer all those questions. Whether you're dealing with stiffness from staring at your screen or recurring aches or something else that feels way more serious. In this episode, we're going to guide you to understand your pain and find the right path forward. So, millions of people live with neck and back pain every day. Some of it is very harmless. Sometimes there can be a more serious problems. Knowing the difference can avoid unnecessary tests, finding relief fast, and when appropriate, act quickly and early on the more serious conditions before they become debilitating. Okay, so in this episode, what are we going to cover? We'll talk about red flags for neck and back pain. When should you be worried? Next, when is imaging necessary and when is it not? Herniated discs. We're going to explain them. We're going to give you some basic information, not that very confusing medical jargon that nobody understands. And then lastly, surgery versus conservative care. What's the best path for your solution? Okay. So, segment one, is my pain normal? Red flags for neck and back pain. What pain can you write off as normal, and which should you send you straight to the doctor or hospital? So, not all neck or back pain requires immediate concern. Some discomforts are a part of daily life, and in many cases can resolve on their own with simple adjustments. Here's a deeper dive into understanding those types of pain and what's considered normal and when is it time to raise the red flags and go see somebody. Okay. So posture related pain. So what's happening? If you've spent hours slouched over at your desk or you're hunched over or you're on your phone or you're leaning awkwardly for hours while you're driving, your muscles are likely overworked and strained. And then you've also put them now in poor posture. So what does that do? That puts your spine out of alignment. What does that do? That increases the load on your muscle, your ligaments, and joints, all of which can cause tension and pain. So when you're slouched for hours, the natural curve in your neck or lower and your lower back and lumbar spine is altered. It changes. That causes uneven pressures in your body and changes in your discs and muscles, and over time, that can lead to tightness with mild discomfort. So, changing some of those positions is going to be something we're going to talk about. So, what are some of the common signs for it, though? So, you could have some aching, some tightness, some tenderness in the area, like the base of your neck or your upper back or even your lower back. Lower back, especially after you sit for a long time or you stand for a long time and you're in a bad position. Stiffness that feels kind of like heaviness or fatigue in your back or shoulders. And other common signs are you don't have any radiation, right? No numbness or tingling down your arms or legs. How do you resolve it? So if it's posture related, typically it's going to be temporary, right? If you catch yourself slouching, correct it. Sit up straight, right? Um, that'll fade the pain in over a couple of hours. Stretching is always good. Ergonomic adjustments to your chair at work or at home, and regular movements are the key for easing discomfort. For example, you could use a lumbar cushion, which I have behind me now, for your chair, keeping your screen at eye level, which I have now. Keeping your eyes at eye level avoid you from leaning forward and putting your head into your screen, right? So the good proper position and proper ergonomics are important for your posture. So let's talk about patient scenario, right? So a patient came in, or a person came in who's we'll say they're a graphic designer who spent 8 hours in front of the computer all day long, pounding the computer. By midday, she notices, oh, my neck is tight, her upper back is aching. She tries to rearrange her chair for her lower back support, raises her monitor, lowers her chair. She's doing everything. So she isn't leaning her head forward, and she's causing different problems. But when she makes those little changes, she noticed by the evening that her pain and discomfort are gone because she made those ergonomic changes to adjust her chair, get everything feeling better. It's just about making those little twists and turns. Okay, what happens if you have mild stiffness or aching? What's happening in the body? So soreness and stiffness are incredibly common, especially after activities that your body isn't used to. So whether it's an intense workout, all right, like right now, shoveling snow that is 30 inches and very heavy, that's a problem. Moving heavy furniture, or or this is going to sound crazy, but simply sleeping in an awkward position, the muscles in your neck and back may become tightened and inflamed. This is especially true if your muscles, you usually don't use them, right? So if the muscles you don't really do much, these aren't muscles that are normally engaged. They can definitely cause strains and sprains, and you could even have some micro tears or some small tears in muscle fibers. Small tears in muscles. Now, when I say that, that's part of muscle growth. So that might not even be abnormal for you. Overnight, as your body stiffens during sleep, you may feel tighter the next morning. What are some of the common signs for that? So you could have dull, aching sensation, stiffness that feels worse when you first get up, but improves as you move around, right? So as you start getting your blood flowing, you start getting your muscles moving, it starts to go away quickly. Localized soreness, often felt in the lower back, neck, or shoulders. Now, the key part to this is your pain isn't sharp, you have no radiating pain, and stiffness is typically confined to the overused muscles that you were complaining about. How do you resolve it? Most mild stiffness is short-lived and usually fades within a day or two. Applying heat to loosen those muscles up, maybe some light stretching, or taking a nice hot shower or a bath can speed up getting the flow through the muscles and get your muscles moving. Also, staying extra hydrated is important, especially after an intense workout. It can help reduce those stiffness, and it helps in the muscle repair. Pro tip for prevention: gradually build up your intensity and incorporate a proper workout. You got to stretch, right? And you on the same token, you need to have a cool down routine. So light stretching in the beginning, light stretching at the end, get your muscles where they need to be. If you often wake up stiff and evaluate, you have to evaluate your sleep setup. Make sure you have a good mattress. Make sure your pillow is good. Make sure your environment is good when you're sleeping, and avoid those awkward twists or positions. So if you have a pet or you're sleeping with one of your children, that can definitely put you in those awkward twists and turns, right? Whether your little 2, 3, 4, 5-year-old jumps in bed with you, and when they get in bed, their arms are spread, legs are twisted, and you're going on trying to find a spot, and you wonder why you wake up and like, oh my God, my back is all twisted. What did I do? You didn't do anything. Change your position in your bed. Let me give you a scenario, patient scenario. We'll call him Mike. Mike decided to help his friend move last weekend. After hours of lifting boxes of furniture, he's like, "Oh my God, my back is sore." The next day, he put a heating pack on, um, The heating pack he put on, it was one that the heating pack was on top of him. Never lay on a heating pack. Have it lay on you. Did some light stretching, loosened up, and avoided heavy lifting the next couple of days. Within a few days, his back was back to normal. It was just a light muscle strain. The muscles weren't used to lifting anything heavy. Very easy, very common. Nothing to be too concerned about. Okay. Next, occasional pain or discomfort. What's happening in your body? So if you have occasional pain or discomfort, it can be a part of everyday life for many, many people, especially as we age or we engage in activities that strain certain parts of the body. Sitting too long, lifting improperly, or emotional stress can cause temporary muscle tension and discomfort in your neck and back. So stress is particularly common and usually goes unrecognized as a back pain or neck contributor. When you're stressed out, your body tenses up, especially in the shoulders or upper back. The tension can cause dull, aching, stiffness, and fatigue. So typically, when you're stressed out, your pain goes to the area of your biggest weakness, right? So wherever you have the biggest weakness, typically your pain goes there. It's not by accident. It is not by accident. What are some of the common signs for occasional pain and discomfort? So minor aches that seem to come and go depending on activity level. Discomfort that improves with light stretching or activity. No serious restriction of movement or daily function, just mild annoyance. Like it's just annoying. It just bothers you. It's not what you're used to. That's what that is. How do you resolve it? Occasional pain typically goes away on its own if the contributing factor like bad posture or prolonged sitting or stress is corrected. So, for example, taking breaks during long periods of sitting is what you should do. Stand up every hour. That doesn't work. Stand up every half hour if you're sitting at your desk. Stand up for 30 seconds, sit back down, and reset yourself. Incorporating some relaxation techniques. Maybe have a 5-minute yoga session with yourself to get your body de-stressed. Or activities of some light exercises to get your blood flowing. Let's go over example scenario for a patient. Samantha will say she was an accountant, spent the majority of her day glued to her desk because it's tax season. By late afternoon, she sometimes notices that dull ache between her shoulder blades and between her lower back. She starts taking a 5-minute walk every hour and begins incorporating daily stretches before bed. With those small changes, her discomfort became much less frequent. And tax season was over, it was all better. No, I'm just kidding. Key takeaways: normal pain, right? So if your pain is localized, mild, and short term, it's usually nothing to worry about. Pay attention to your habits and see if you can be contributing to your discomfort. And use simple remedies like heat and stretching and also rest to help your body recover. However, if your pain persists and worsens over time and is accompanied by other symptoms like tingling, weakness, radicular pain, it's time to dig deeper and considering consulting a healthcare provider. Let these insights guide you in differentiating between everyday discomfort and pain that needs attention, and listen to your body. That is the key, to listen to your body. It is so, so important to listen to your body. Okay. Now let's talk about red flags to watch out for. This is when the red light is going off on you, right? So while most neck and back pain is common and self-limiting, certain symptoms can be a red flag and severe. So we have to make sure we understand those warning signs that something more serious might be happening. Understanding them and recognizing these signs can be crucial for preventing long-term damage or underlying conditions that require immediate medical attention. So, sudden severe pain, what's happening? If you experience a sharp, sudden onset of neck or back pain that doesn't seem to be tied to any obvious cause, like a workout or lifting something heavy, it could be a signal of a serious condition. Sudden severe pain is often points to structural issues in the spine, such as a disc problem, a rupture, spinal cord problem, or an infection. Sudden pain can arise from conditions like a slipped disc, herniated discs, fracture, inflammatory condition. So, understanding the common warning signs, right? So, if you have intense pain that is unbearable, but doesn't ease with rest or over-the-counter medication, and then you couple that pain with the inability to move certain parts of your neck or back, don't ignore it. Seek medical attention to address and immediately rule out the problems like nerve damage or fractures or infections or anything of the sorts, right? So you want to be smart about it, right? If you're getting those severe pains, you have to go see somebody, right? Don't just say, oh, it's going to go away. If you can't move and your pain is a 8, 9 out of 10, and as soon as you move, you're getting those jabs, you need to go see a medical provider or a healthcare practitioner to go find out what is happening, right? It could be something severe. It might not be as severe, but you need to check it out. You need to understand what it is. Be smart. Understand yourself. So let's go over an example of something that I've seen in practice. So we'll say a person was a 52-year-old construction worker, woke up one morning with extreme pain radiating through his back. Even though he said that he has not done any heavy lifting recently. After consulting his doctor, they did some imaging and they revealed the patient had a slip disc rupture, which was compressing on the nerve, and that required immediate treatment. What they didn't tell you is 2 days ago, they lifted a bathtub by themselves, and even though he didn't do anything that day or the day before, it was previously, and it just came out a little bit later on. That can happen, right? So sometimes, a lot of times I'll have people tell me, Doc, I didn't do anything. I woke up and I can't move. Now, the more you talk to them, the more you understand. Maybe it wasn't yesterday. Maybe it wasn't the day before. Maybe it was a couple days ago, and it's just built up over time, right? Could be a couple days, could be a week, could be a little bit longer. Everybody's a little bit different. Okay. Speaking of that, pain that worsens over time. What happens in your body? So pain that keeps worsening day after day, despite rest or over-the-counter medication or some light treatments, may be a sign that your condition is progressing rather than healing. This could be a point of problems like, I don't know, it could be a lot of different things. It could be like facet joint arthritis, could be degenerative disc disease, could be spinal stenosis, could be sciatica, could be a lot of different things. Typically, these issues occur when inflammation continues to aggravate the surrounding structures or when cumulative damage leads to more widespread tissue involvement, right? So as it starts in one little spot, then it spreads and spreads, then more areas are involved. That's what that's talking about. So common warning signs, pain that intensifies progressively no matter what you do, such as, so you're basically saying pain that gets worse. And like, Doc, I didn't do anything. I sat on the couch. I didn't move. I didn't lift anything. I didn't go up and down stairs. I didn't take long walk. I didn't do nothing. I just stayed there. That's a sign. Pain that doesn't go away after weeks or disrupts your sleep, right? So that's a growing intensity. So you want to make sure you get that checked. So those are two big warning signs. What to do. So chronic or worsening pain may require imaging, right? You might need an X-ray or an MRI. So first step is go see your doctor. They'll determine if you need any imaging or what you would, how to assess what's going on, whether you need chiropractic, whether you need physical therapy, whether you need medication, so on and so forth. They'll determine what's going on. Okay, let's get into a patient example. We'll call this patient Maria or Susan. We'll call her Susan. Why not? Okay, we'll say Susan's a 40-year-old person who started to have mild back pain when initially started. She basically said, she just chalked it up to stress and long hours at her desk. But then 2 months later, it's still there, and now it's progressed to severe pain that left her unable to sit or stand for 10 minutes at a time. She had X-rays, and they revealed that the patient had spinal arthritis that was causing inflammation in her facet joints. She required therapy and some medication, right? So that's something you have to pay attention to. Okay, next, pain that is radiating. So what is that? What's radiating pain? Radiating pain is when you have discomfort from your neck or lower back. If it's from your neck, you're going to have pain going down your arms. Could be down to the mid part of your upper arm, or it could be down into your forearm or hands and fingers. If it's your lower back, it can go down your leg and into your toes. That usually means that something in your spine, like a herniated disc or a bulging disc or a bone spur, can potentially be putting pressure on a nerve and disrupting your normal function. So this type of pain is typically called radicular pain. The sensation often includes symptoms of neuropathy, such as tingling. So when they say neuropathy, that could be just mean tingling or numbness or muscle weakness, right? Because the nerve is struggling to transmit signals normally, right? So you're affecting those nerves. Common warning signs: sharp burning pain followed by a specific nerve pathway. What does that mean? Okay, so you have pain that goes down your arm into your thumb and index finger. That is a specific nerve. Or you have pain that goes down your arm and it goes into these three fingers. That is a separate, distinct nerve. If you have pain that is doing something like that, that is a very, very specific nerve. The same thing in your lower back, right? You have pain in your lower back, goes down your leg, goes into your big toe. That is a specific nerve. You have pain in your lower back, goes down your leg, goes into your pinky toe, and just a little bit of the tips of the next two toes. That is another nerve. Those are all things that you should be paying attention to and have an understanding of what they are. And that's the important part with that, is to understand what they are. What do? Don't ignore them. Do not ignore your nerve signs, right? Those are nerve compression signs. Prolonged pressure on a nerve can lead to permanent damage. So really, you need to consult your doctor, who may prescribe physical therapy, chiropractic, anti-inflammatories, imaging. Really depends on what your other symptomatology is. So let's go over a patient scenario. We'll call this patient Tom. Tom is a 38-year-old person that has pain shooting down his left leg after he lifted a heavy box. After weeks of ignoring it, he began losing strength in his calf and foot. MRI confirmed a herniated disc compressing his L5 nerve root. He needed treatment right away. Okay, next, loss of bladder or bowel control. So what is happening? If you're experiencing back pain with loss of bowel or bladder control, that's a medical emergency. You need to, as they say, don't pass go. You need to go right to the hospital. This condition is known as cauda equina syndrome, and it occurs when the bundles of the nerve roots at the base of your spinal cord, the cauda equina, becomes severely compressed. If this is not treated immediately, it could result in permanent damage. So if you have bladder or bowel control with back pain, you need to go to the hospital immediately. Okay. So common warning signs: difficulty starting or stopping urination intentionally, right? You can't go and you can't stop. You just go on yourself without trying. You didn't even know you were going until you felt it. Loss of sensation around your groin, buttocks, or inner thighs, meaning you can't feel it, right? You're touching, you don't feel it. Severe lower back pain occurring alongside the bladder or bowel dysfunction. Call 911, get to the emergency room. That is an emergency condition. Okay. Unexplained symptoms. So sometimes people who have symptoms, you have no idea what's going on. Certain symptoms that occur alongside the back and neck may point to systemic issues like an infection or cancer or other serious condition affecting the body as a whole. So pain accompanied by unexplained weight loss, chills, or fever should never be ignored, right? So pain with unexplained weight loss, chills, fever should never be ignored. These conditions disrupt normal tissue function within the spine, but may involve broader organs, systems that require blood work or other imaging for diagnosis. So, common warning signs: fever and chills. You also have back pain. You also have night sweats. You have pain with rapid weight loss. That is a medical emergency. You need to talk to your doctor immediately. They require immediate investigation. Okay, next, trauma-related pain. So if you've experienced any kind of physical trauma, such as a car accident, a fall, sports injury, the structure of your spine could be compromised, even if the pain feels manageable. So direct trauma can cause fracture, ligament tear, dislocations, or even nerve damage, all of which require imaging and evaluations to rule out complications. What are the warning signs? Severe pain. It could be dull sometimes after an accident or fall. Difficulty moving, standing, or weight bearing. Bruising or instability in the neck or back region. What to do? Do not assume your pain is temporary, especially after an accident. Even sudden injuries can worsen over time. Seek a medical or healthcare provider to rule out fractures, bleeding, or any kind of tissue damage. It's important to know those little tiny pains you have, don't ignore them. Make sure you get them checked out. Okay, let me do a quick recap of red flags. Sudden severe pain. Pain that worsens steadily over time. Radiating pain with numbness and tingling. Loss of bowel or bladder control. Medical emergency. Back pain and neck pain with fever, chills, or unexplained weight loss. Pain following trauma or accidents. Recognize red flags early can be life-saving and prevent permanent complications. When in doubt, consult a healthcare professional. Okay, next. Segment 2. When do you need imaging? And when don't you need imaging? Do you really need an MRI or an X-ray? It's one of the most common questions patients ask is, should we get imaging? The truth is that not every pain needs fancy and unnecessary imaging that can lead to overdiagnosing or stress or findings that don't need treatment. So when is imaging not necessary? So if you have mild pain that lasts a couple of hours, and let's say you're sitting at your desk and you from looking at the computer, you strained your muscles. You typically don't need X-rays for that, right? If you've had that for 6 weeks, then yes, then you would need x-rays for that. But if it's been a couple of hours and you didn't do anything, right? You just have some mild discomfort. You don't necessarily need x-rays. Obviously, everything's predicated on the rest of your history. So you gotta take it with a grain of salt because sometimes when you're talking to people, you find more things out as you're talking to them, and then you're like, oh, maybe you do need x-rays, right? So that mild pain might have been there, but you might have had it 3 times over the last few months. And you come to find out you did have a fall or trauma 6 months ago and you didn't do anything. So yeah, all right, in that case, then maybe you would. So you have to put it all together, right? So the simple answer is you really got to do a great history and physical to understand if you really need imaging or not. Imaging could be either x-rays, MRIs, CT scans, all of that. It really depends on what's going on with you and how your symptoms are, right? So when is trauma needed? I mean, haha, when is imaging needed? Imaging is needed typically if you have trauma, right? If you had a fall, accident, or a car crash, you typically would need x-rays, sometimes MRIs. You want to potentially rule out a fracture or soft tissue damage, you definitely need it, right? If you have neurological symptoms, neck pain with tingling in the arms or legs, you'd want to see some x-rays. Severe or worsening pain, pain that gets worse over time is not responding. Yes, you want to see imaging. You want to know what's going on. You want to know what the inside looks like. Unexplained fever and chills and weight loss. Yes, you want to see imaging. You want to see if there's something else going on, right? You want to make sure it's not an infection, cancer, or something else. That's the important part. Okay, next segment is segment 3, herniated discs. We're going to explain it without all the medical jargon to confuse you. So, what is a herniated disc? So the disc is between your vertebrae. They're like little cushions, and they're called discs. They act like shock absorbers for your spine. Each disc has a soft, jelly-like center surrounded by a hard, rubbery shell. The herniated disc occurs when the soft center leaks out, pressing on the nearby nerve. So, real quick, a disc bulge is when we have that jelly material. You squeeze like you squeeze the jelly donut, right? You squeeze the jelly donut. The jelly's popped out a little bit, but it's still inside the donut. That's a bulging disc. A herniated disc is when you squeeze that jelly donut and the jelly pops out and it's coming out, it's leaking out. That is what a herniation is. Okay. Now you understand the difference. How does it feel? So localized pain is pain in the lower back or neck that stays in the affected area. Radiating pain is pain that travels down either the arms or legs, and those are nerve compression. Other symptoms could be you could have numbness or tingling or weakness in the limbs. What causes a herniated discs? Most herniated discs occur from either wear and tear, aging, or sudden strain, or lifting, or trauma. You can have any one of them. So really, a lot of different things can do it. Do all herniated discs need surgery? Nope. The majority of herniated discs improve with conservative care like chiropractic, physical therapy, rest, and some anti-inflammatories. Surgery is usually only reserved for cases that are severe where symptoms like weakness or incontinence are present. Segment 4, surgery versus conservative care. How do you know when to treat pain conservatively or pursue something more severe like surgery? So how do you decide, right? Pain is there. Do you go conservative? Do you go to a surgeon? When dealing with neck and back pain, especially with herniated discs or other spine-related conditions, choosing between surgery and conservative care can feel overwhelming. For most people, the decision hinges on the severity of the symptoms. How long has it been there? How have they been feeling? Whether or not they've had conservative care or any other non-invasive treatments. Let's go over that breakdown. So when to consider conservative care, right? So conservative care is always the first line of treatment for most neck and back pain, even herniated disc. Is so this would include rest, chiropractic care, physical therapy, ergonomic adjustments, and lifestyle changes, all a part of conservative care. They all going to talk about promoting healing and aim to improve function naturally without invasive procedures. In fact, studies have shown that 90% of herniated discs are improved without surgery, with significant pain relief after 6 to 12 weeks of conservative care. So what is conservative care? So we'll talk about two of them specifically. So first one we'll talk about is chiropractic care. Chiropractic focuses on improving your spinal alignment, restoring mobility, and reducing tension on or reducing nerve pressure. Chiropractors use spinal adjustments, soft tissue therapy, and posture support to relieve pain and enhance healing without surgery or medication. It's kind of our mantra. Research has shown that chiropractic care can effectively reduce neck and back pain by addressing the root cause of the mechanical dysfunction. Chiropractors customize treatment plans and often complement other therapies like physical therapy or exercises for long-term relief. When it's effective, chiropractic care is particularly helpful for misalignments, nerve compression, poor posture, stiffness, headaches. I can go on and on and on, but we'll keep it at that. It's also beneficial for non-severe herniated disc cases or bulges or patients who experience alignment-related discomfort. Physical therapy is the next conservative care. So physical therapy is designed and targeted programs to strengthen muscles, improve posture, and teach stretches that relieve pressure on the spine or nerves that are causing pain. Physical therapy is ideal for multiple conditions, including postural imbalances, weak supporting muscles, nerve irritations, and recovery after injuries. Regular sessions can prevent symptoms from getting worse and the need for more involvement, right? So physical therapy not only promotes healing, but equips the patient with tools to strengthen and get them ready so they don't have another problem, right? They're going to prevent recurring pain. Next is medications. Non-steroid anti-inflammatories such as ibuprofen or aspirin are commonly prescribed for reducing pain or swelling caused by soft tissue injuries. For nerve-related pain, like a herniated discs, they might give you something like a muscle relaxer or something else. Lifestyle adjustments, changes to your daily habits and work or home environment can make an enormous difference in managing your back pain. For example, getting an ergonomic chair for your work, or using a standing desk, or doing some mild stretches during your workday to get you reset. When surgery may be necessary. So when conservative care fails, then surgery might be necessary. So what does that mean? That means conservative care works for the majority of pain cases. There are times where more aggressive treatments like surgery may be required. You might have severe nerve compression with progressive pain and weakness, and you might be completely affecting that nerve. That might be a scenario where you want to talk to a surgeon. Loss of function, right? Severe weakness, loss of coordination, or difficulty walking or standing or gripping objects. You typically would want to talk to a surgeon during that time. Bowel or bladder control, you're going right to the hospital, calling 911. Chronic pain that doesn't respond to conservative care. So if you tried multiple strategies and you've done therapy for anywhere from 8 to 14 weeks and you're not getting any better, you might want to talk to an orthopedic first, and then the orthopedic doctor would tell you then if you need a surgeon or not. That would, right? So there's steps, right? So you do conservative care, orthopedic, the orthopedic, whether they're a surgeon or not, you would go to the orthopedic, and then they would say maybe you need an orthopedic surgeon to be evaluated. Trauma or spinal instability, right? So if you have back pain caused by trauma, like a fracture or scoliosis or severe degeneration, that may require stabilization surgeries or fusion or something of the sort, right? Um, you want to understand what's going on with your back. Obviously, again, the same type of scenario with that. You're going to go to the orthopedic first, and then you would go to the surgeon after. So the balance between conservative care and surgery. So typically you're always going to start with conservative. You start with the most conservative care and then you progress, right? So hopefully you're going to get better and you won't need to go anywhere else. But there are cases, obviously, that people do need surgery. So you have to understand your symptoms, understand your pain, and always get your opinion. You can always get a second opinion too, right? So you go to one doctor, hear what they have to say. You can always go to another doctor, hear what they have to say. Hopefully they agree or disagree, and then you could have a determination to what's going on with you. Key takeaways are try conservative care first. 90% of the conditions improve without surgery. Surgery is always reserved for last resort. Last minute takeaways. Most neck and back pain is normal and manageable with conservative care. But watch for those red flags like radiating pain, the neurological symptoms, or trauma, and don't hesitate to seek medical attention when needed. Herniated discs are common and often mild and rarely require surgery. Think of them as treatable bumps in the road rather than roadblocks. Understand them, even though so there's a statistic out there that over 70% of people have a herniated disc with no symptoms. So when I say treat them as bumps, because they could be bumps, but you don't know that yet, right? So you have to understand what's going on with them and make the appropriate choices. Seek a healthcare professional to determine what is the best road for you. Because every patient is different, every road is different. What works for you might not work for the person next to you. So your road is your own road to take, but you need to have somebody steering the ship so they can help you make sure you get to your destination. Destination is pain-free, right? As best you can, right? Understanding all of that is what it's about. So last thing I'll tell you is pain doesn't have to control your life. With the right understanding, care, and proactive strategies, you can take charge of your neck and back health and consistently stay moving forward. So as I always say, the information I've given you today is my opinion alone. If you had any one of these conditions or any one of these problems, please seek a medical provider in your area to get a proper evaluation. Do not take what I've told you as medical advice, just my opinion. With that said, you don't have to stay in pain. We treat people all day, every single day. Patients that come in tilted and twisted. Your body angles one side. You're like, oh my God, what's going on? Funny thing about that, not funny, but when you see a patient and their whole body's tilted to one side, what's happening is, and it's the miracle of the body, to be honest with you, your body's actually forcing you to be in a different position, right? So if you're angled this way, your body's forcing you to stay that way because if you straighten up, you're going to compress that nerve even more and do more damage to you. So your body's in self-protecting mechanism right now. It's saying, no, you are not going that way because you are going to hurt me. and your body's protecting itself. How crazy is that? That's so cool to me. It's so cool that your body knows I I am not going to let you do this. And it basically causes pain and inflammation enough for you not to do that. With that said, a lot of those patients do get treated and do very, very, very well. Occasionally, they do need surgery. So the simple question when I first started it, is my pain normal? Now you have the answers to say yes, no, maybe so. As I always say, you got one of these. It's important. Take care of yourself because your health matters. I'm Dr. Chillemi. Till next time, be well, be safe, be healthy.